Thanks. I'll kick things off because I do have to depart shortly, but I just wanted to make sure that I had time to join. Good afternoon, everyone. My name is Sally Guzik. I'm the General Manager at CIC Philadelphia, and thanks for joining us today. We're really excited to start welcoming folks back on site. We started to see a little bit of an uptick since we've moved into the phase yellow. And of course, as you'll hear more today, several of our lab clients have been on site, some of which have even been working on COVID over the past 3 months. So I just wanted to first say thank you all for hanging with us through such a troubling and uncertain time, both in regards to the pandemic and also recently with all of the current events. I know that your time is valuable and of the essence, and we've just really appreciated all of your support, feedback, comments, things that you've shared with us from all regards from making the space feel safe to how we're engaging with the community at large over the past 3 months. And I know it's been really difficult to do that in a remote capacity. So I'm going to quickly turn things over, but I'll just kind of frame what the Q&A will cover today. We'll have both a recording of this Q&A, and we also have the one available from last week that in case it covers anything different, that you'll have access to both videos. Thanks to the operations team and our events team for helping to plan this. You'll see several folks from our team, from our events, operations, and sales lead. Also, several operations team members are here to answer any questions that you may have. And Melina Blees, the site director for BioLabs, will also be speaking regarding COVID, both in the capacity of the lab, the users in the lab, and also kind of an update where we're at in the city of Philadelphia. So as most of you have seen, CIC did roll out a global safety plan. We've been in the midst of making sure all of those things were installed and ready to happen. And as you'll hear from our operations director today, Ian, we were able to make sure that all of those changes were made by June 1st. So they'll definitely be ready as we move through the yellow and the green phase for folks as we're welcoming more people back on site. Just a reminder, for any COVID cases that we're reporting that are positive on the site, please let Melina Blees and myself and Ian know so that we can also make sure that we're covering all cleaning protocols and contact tracing. CIC does have a contact tracing team located in Cambridge, and what they are able to do is both match keycard data reporting and video footage to ensure that we're reaching out to everyone that's had 15 minutes or for Philadelphia, 10 minutes or more prolonged exposure to somebody within 6 feet. That's the measure that we're using for that piece. I'm gonna hop off and let the rest of the team handle this for today, but I'm happy to answer any questions. And the team, like they said, they can answer any of the questions that come up in the chat box throughout the meeting, and they can provide my email address in the chat box as well, as I'm always happy to answer any questions or concerns or continue to receive feedback in the coming weeks and months. So again, thank you all so much for joining us today, and I'll turn it over to the rest of the folks here.
Thanks, Sally. I'll take over some of the moderating duties here and pass the torch to Melina.
Hi, everyone. So I know some of you, for those who don't know me, I'm the site director for BioLabs here in Philadelphia. So we're a company who's partnered with CIC in Philly to offer laboratory space. So my team basically runs everything behind the no food or drink sticker on the 5th and 6th floors. So just to give you an idea, the labs never really shut down. You can't really stop laboratories in any practical sense. So we've been putting into effect lots of extra precautionary measures. A lot of our labs residents have kind of scaled back their operations temporarily, doing shift work, lots of things like that. I've also been doing COVID fairly full time. I'm actually trained as a physicist, not as a biologist, but I've been doing nothing but reading about COVID for the last 3 or 4 months. So I wanted to update you guys on kind of what the latest and greatest research is. I know some of you are also scientists out there or are particularly invested in this topic. I know Vinu, your team is actually working on a COVID project, so please hop in if you have things to add. We do have, let's see, 3 companies within the labs and a couple who are outside the labs who are working on COVID-related projects. None of them have live virus on site, so you don't need to worry about that. But there are folks here who have been continuing kind of to carry on the fight, both for vaccines, but also for therapeutics and for testing projects. So it's been a real motivator to kind of get up and come to work every morning knowing that we're helping in a small way to support companies that are doing something really important to try to get us back to the world we remember and miss. In terms of kind of the latest research, what we're really seeing is that the primary way that COVID is being transmitted between people is close contact, which means, people who work close to each other. We see a lot of cases of folks who have desks right next to each other, for instance. It seems like the primary way this is being transmitted is through the droplets that you produce when you breathe, when you sing, when you speak, or when you cough or sneeze. So anything we can do to kind of put a barrier in front of your face is incredibly important, both for protecting you, but also for protecting everyone else. And so that's why we're being so careful about enforcing mask policy on site. You have to be wearing a face covering at all times in any of the shared areas and anytime you're in the labs. So the best thing you can do is to wear some kind of face covering that will protect other people from your respiratory droplets. It will also provide some protection to you. There's been some recent meta-studies that have shown that, wearing even just a fabric mask is helpful in protecting you. There are also ways that you can improve your mask. And if anyone's interested in kind of talking about different mask technologies, different kinds of additional filters, things like that, I'm happy to connect with you offline about ways that you can protect yourself as well. What we've seen is that there's less evidence for what we call fomite transmission, which is touching the virus on a surface and then touching your face in a way that can transmit the virus to you. We can't say for sure that that doesn't happen. It's fairly likely, I think, that it's possible, but it's not the primary way that people are picking up COVID is really what the data is starting to show. So it's always a good idea to, use your elbow to open doors, clean the surface when you sit down, clean the surface when you leave. But in terms of protecting each other and protecting ourselves, masks are really the major priority. We did talk about kind of close contact. So that does mean, sitting down next to somebody, taking off your mask, having a cup of coffee, or sitting next to them for more than 10 minutes, even if you're wearing a mask, if they're really close to you. Things like this can start to be really routes of transmission. Passing somebody in the hallway, not really a major risk. So again, I recommend, stay two people max in an elevator, stay separated from other people, stay 6 feet apart. If you aren't sure what 6 feet is, we have on the 5th and 6th floors in the elevator lobby actually like physical markers of what 6 feet is. Because frankly, it's farther than I thought it was. But the best advice that I've been seeing out there is, and this sounds kind of silly and slightly gross, but pretend that people are farting really badly and you don't want to smell their farts. So basically, wearing a mask is helpful, but so is being in a well-ventilated space. If you can go outside to eat your lunch, even if there's some other people 6 feet away from you, chances are there's, a lot of wind and it's going to dissipate the virus if they're exhaling virus. The really important thing to remember is that we don't always know who has COVID. It's possible for people to spread it when they don't have symptoms. It's possible for people to spread it before they start exhibiting symptoms. So you could also be sick and not know it. So please wear your mask. Protect other people by wearing your mask. Wear it consistently. Most importantly, we have some folks on site who have family members that they live with who are immunocompromised. So by consistently wearing your mask, by washing your hands for 20 seconds at a time, by staying socially distanced from other people, you could be saving someone's life. And that's a really important thing for us all to remember. So cool. Anything anyone wants to add who's been working on this sort of stuff? All right. Well, I will pass it back to Emmett. And again, if any of you have any questions about COVID, if you want papers, resources, mask suggestions, things like that, please don't hesitate to reach out to me.
Lena, can I ask you one quick question?
Sure.
Do the shields help at all? Are they additive? Or, yeah, face shields.
There is some hypothesis that you could have respiratory droplets get into your eyes. So wearing a face shield or wearing safety goggles or glasses is thought to be protective in addition. I don't know that there's a nice number put on that yet. I have seen one very recent study that showed that for doctors who are in these very kind of high viral load environments, that it is showing an effect of wearing a face shield. I actually have some disposable ones that are light and comfortable to wear. So if you want one, connect with me offline and I can get one to you. So it does help. I believe it helps. But so does, for instance, wearing a layer of nylon over your mask, or building a rubber band harness on your mask that improves the filtering. So there are a number of things you can do if you're worried about your own health, that we can help you kind of work towards a more protected PPE situation.
Great. Any more questions for Melina? Awesome. Well, thank you for the update, Melina, and thanks for doing all your extra research. And Ian is going to talk a little bit now on what CIC ops team is doing to make sure that labs or office clients specifically are being protected in all public spaces.
Yeah. Hello, everyone. As Sally mentioned earlier, I am our what we call our community lead here. So I manage our operations team, as well as kind of the physical space within CIC. And I can give a quick rundown of what some of the changes that we've made, and some of the things that our building management is doing as well for the building as a whole. Apologies that I'm getting some sunlight like right in the window of my office here. So if I am squinting or look concerned, it's probably because I'm trying to block out the sun a little bit. But as Melina said, kind of our major focus right now is making sure that people are wearing masks. We do a few checks a day, sweeps of the floor, just to remind people that maybe are wearing the masks incorrectly, or may have forgotten their mask in their office or in a conference room, to put their masks on. We have a lot of prominent signage reminding people to wear masks. We are requiring clients to wear masks in all public spaces. We've also made some adjustments to our kitchen spaces to remove some of the seating there, to kind of limit some of the public gathering space. We are working towards, as we mentioned also, I think a lot of the science is moving away from touch being a high level of kind of passing the virus. We are still have made a lot of changes to make the space as touch-free as possible, both from before that understanding really became prominent, but also just as a kind of belt and suspenders kind of approach to safety here. So we've added foot poles on our conference room and main doors. We've added these nanoseptic covers that where the virus is not able to live after a period of time. We've increased some of our cleaning and provided a lot of safety measures in order for people to get from the front door of the building to their office without having to share any major touch points. We've also have provided some signage on a lot of our floors to kind of encourage people to distance in the hallways as well as in conference rooms. We've adjusted our seating in conference rooms to make sure that people are aware that they are distancing, 6 feet apart within that space. We are also at this time asking clients to wear masks in conference rooms as well. We have set up a few conference rooms as private eating spaces. So as we have shut down our kitchens, when it comes to seating and places to eat lunch, we're looking to find safe spaces for people to be able to eat outside of their office. We're also working with the building to have them install seating on our patio on the 3rd floor as an additional outdoor eating space for people to be able to take lunches in the space. We've made some changes to our kitchen offering, being able to provide the same level of service and the same kind of amount of snacks and coffee and tea, but moving towards single serve individual packaged items. Before this, our offering was mainly bulk snacks and, loose leaf tea and things like that, with an eye towards sustainability and things like that. But we realized that, at least for a little while, that our goal is, to have things be able to be kind of grab and go items that are individually packaged, that people can bring back to their office or one of the, kind of designated eating areas. As for some of the building changes, we've confirmed with the building that they have, that the HVAC system in the building has a filter that is actually exceeding what the recommended amount of particle filtration for COVID. This is typically the MERV rating for the filter is actually a few ratings higher than what is traditionally thought to be able to filter out the COVID particles. So that helps with both with air circulating in from outside, as well as recycled air in the space. The building has designated, with the exception of the lab floors, stairwells as up or down stairwells, to try to avoid some of the crossing paths in the stairwell. They've also increased the cleanings and disinfectings in the stairwells as well. And that is in part because they are limiting access of the elevators to allow for social distancing inside the elevators. We're also requiring clients to wear masks in the elevators as well at this time. The restrooms, the building is currently looking to install automatic fixtures for the soap dispensers. They are also exploring kind of further no-touch options for the stall doors, and have added, in addition to the foot poles that we have on the space, arm poles for the restroom doors as well. So as Melina mentioned, the main kind of, what we're asking of clients as they enter the space is, at this point, mainly focused around distancing and mask usage. So that's what we are, communicating to clients, and what we're going to be kind of looking at most closely as we are, walking through the space, doing our sweeps, and what we are conveying through our signage in the space as well. Okay. Yeah, I think that covers. Oh, sorry. There's one other kind of behavioral, community change there, is that we are rolling out a symptom check application. Yeah, Stephanie just dropped it into the chat here. Thank you, Stephanie. So this is developed by our software development team based out of Poland, and it is going to be clients will be receiving an individualized link to the symptoms check. So we are going to be asking the clients submit just a quick check that they don't have a fever and don't have any symptoms related to COVID. We are not storing any of this information. We are just asking clients to confirm before coming into the site that they are free of any symptoms. This will be tied to our key system. So if clients haven't filled it out, they'll get a notification just reminding them to do so. And we will have, thermometers set up in the lobby by our virtual concierge system that will be able to be used if someone forgets to do it at home beforehand. We also have an iPad set up for guests with the same self-check information for people to fill out before entering the space. So as of right now, we have also set up a virtual concierge system to both, kind of limit another person to interact with as you come into the lobby. So our typical concierge is now going to be answering those calls remotely. So we have a touchscreen monitor set up where someone can just, gel their hands, touch the monitor, gel their hands again, and be connected to one of our concierges and receive the same level of service as you would expect of, our typical concierges being there in person. So we will, yeah, so the virtual concierge is live at the moment now. We are asking if people do have guests during this time to let us know ahead of time so that we can pre-register them. And if possible, to provide an email address ahead of time just for contact tracing and other purposes.
And I would hop in and say that there's an additional form process for the labs. So for anyone who's working within the labs, there's extra stuff that I will connect with you about separately.
Yes. Martha, to answer your question, at this time, the connection to the key system will not deactivate keys. It won't bar entry. It just sends a reminder to fill out the survey.
Okay. It's one of the things our company is reflecting on. We've got 2 sites, lab sites there, and then another site in Philly for office space. And a lot of different opinions of our employees and leaders around are the self-symptom checkers. Is anyone going to do it? Is it worthwhile? Do you need to centralize the data? So I'm just looking for any experience. Are you guys planning to try to track in any way if this is actually being utilized or if it's helpful?
So we will be, I think, tracking. Essentially, we have also gone through a lot of the same kind of conversations internally, and we will be tracking whether they're filled out, but not the data they're in. We're not holding any of the medical data, but we are, going to be looking at, whether it's kind of being filled out consistently. If we're getting a lot of these notifications going through that people aren't filling them out, at this time we won't be, kind of strictly enforcing. There won't be any sort of, again, like, punishment, to clients that don't fill it out at this time. But I think we will be kind of like looking closely at how many people are filling out, how many of these notifications are going through, and if it looks like, and again, we're trying to keep kind of abreast of the science part of this as well, of how much of an impact this makes. And I think what people are saying now as to how much of a, how important this is to limiting spread of symptoms and things like that.
Thanks.
Mm-hmm.
And Ian, just to confirm, we had a question come through privately that this is already something that's in effect in some regard, and obviously it's a work in progress, right? But it's in effect as of right now, and changes may come to it, but essentially the self-check is active at the moment, just to clarify that, right?
Yes. Yeah, the self-check should be active now. Sorry, I know we have the link that Stephanie dropped into the to the chat here is the non-individualized self-check. So this is the general self-check that can be used for guests and for clients. I think currently I need to double check if I believe the client individual one is being rolled out. If it hasn't been rolled out yet, it will be, I think, at the beginning of next week. I think that's what I need to double check. I know it's been rolled out for staff, which is for our staff. So we check this every day as well. So that's where I'm a little, just need to double check that clients will actually be receiving these things, these emails every day, and the reminders if they don't check in.
And then we have another question about visitors, specifically lab visitors, and whether they'll need to pre-register with CIC in addition to filling out the BioLabs visitor form.
Yeah, I think as long as you are pre-registering with BioLabs, that should be sufficient. We will still, again, have our virtual concierge in the lobby, and we can still connect you to your host and things like that. But as far as like pre-registering, as long as that information is living with BioLabs, then that should be sufficient. Great.
All right. Any other questions for Ops or Ian? Excellent. So we can go ahead and move on to some updates from our relationship management department at CIC. And I think Ramon is going to take that on, if not Stephanie.
Hi, everyone. My name is Ramon. I'm the relationship management team lead. Myself and Stephanie Gomez Menzies, who is on this call, we we are the relationship management team here at CIC. I just wanted to remind everyone, well, first I want to thank everyone for weathering the storm and sticking with CIC. We really, truly value your commitment to sticking with CIC and trusting with us. As Ian said, we have a lot that we're doing operationally, but just to remind everyone, the relationship manager exists as your point of contact. The operations team is there. We have an events team. We have the general manager, Sally, but you can always feel free to reach out to the RMs if it makes your life any easier, if you have any questions. So just a few updates. CIC, in addition to the safety plan that Ian just went through, which is pretty robust, I wanted to let everyone know that if they need or have questions with regards to your office layout or office design, feel free to reach out to the relationship managers. We can provide some recommendations on your individual offices and what we could recommend in terms of the number of roles that's recommended, number of people, occupants that's recommended for offices. If you need offices to accommodate social distancing measures any further, you can again really reach out to your relationship manager and we can take you through some options. We're happy to work with you. We know these are challenging times and we know that everyone's unique needs are unique. So don't hesitate to reach out to us. That's why we're here. We are here to help your relationship with CIC. That's why we're your relationship managers. So also with regards to communication, be on the lookout. We will be communicating to everyone periodically as we move through this period of uncertainty. The relationship management team is at the forefront of communication, always reaching out to the community with any updates, anything that's going on that we think you need to know. But again, if you have any questions, always feel free to reach out to your respective relationship manager. Stephanie just typed in the chat what our email address is. So if you reach out to philly@cic.com, it goes out to all the members of the relationship management team, as well as our general manager, Sally. So if anyone has any questions, feel free to reach out to us. Again, happy to see everyone on this call and happy to have you as a member of the community.
Thanks, Ramon. Any questions otherwise for sales or relationship management? Okie doke. We can move on to Mina, who's going to cover some of the updates for events in relation to COVID.
Hi everyone, my name is Mina. I am the events lead, and Grace, who's also on this call, is our events coordinator. So just a few quick updates about some changes to our events model right now. So currently for yellow phase, which we're in, we are not allowing any in-person events in our event space. However, we are allowing all virtual events. So that's to say, if you and your team needed to broadcast out to a fully virtual audience, Delaware River, our main event space, is still available for you to rent out. And we have all of our equipment there available for you. And we've also just had a small upgrade, and we have a full kit that you are able to use, plug into your computer, and just provide a little bit of a higher quality of broadcasting for your event or for your meeting. In terms of how to go about that, if you have any questions on how to reserve a room for your virtual event, you can always reach out to philly-events@cic.com. And if you just have general inquiries or questions about video conferencing, how to set up a virtual event for yourself, we'd be happy to kind of walk you through some best practices. And we also have some really helpful one-sheeters just around some video conferencing tips and tricks. So we'd be happy to send those along as well. So in terms of CIC events that you're used to, just like in our space, things like happy hour, community breakfast, those are all currently on hold. But in lieu of that, we have a really great selection of virtual events that our CIC events teams across all of our sites globally have actually been working really hard to curate. So if you go online to our events calendar, or if you log into the portal and check out the events tab, you'll see that there's actually a lot more programming available than would be in person. So really great way to connect with people from different CIC communities at different sites, but also great way to just check out some programming if you ever need a break or want to learn something new. We have some really great virtual wellness programming, as well as some really great industry focused, content focused events that our sites are putting on as well. And if anyone ever has any sort of requests or feedback, things that they would like to see that CIC could kind of help you curate, or we can kind of curate for you or your community, please let us know. We'd be happy to kind of listen to what your needs are. Just another reminder that every Thursday we are still continuing to have virtual Venture Cafe. So from 3 to 8 p.m. for Philadelphia, but another cool thing, because this is virtual, all of the Venture Cafe locations across the world are also doing this. So starting at 12 a.m. actually every Thursday, you have a full day of really cool programming that you can check out, jump in on anytime. Along with that, our partner Quorum, who runs our lobby in 3675, is also hosting some really great virtual programming. One really cool program that's really just easy to jump in on and enjoy is their lunchtime, virtual lunchtime learning lessons. And they've had people just showcase some really cool tips and tricks, anything that they are passionate about or they're an expert in. So just some really fun programming available if you're looking for that. Another reminder, we have something called the CIC Marketplace that we put together during this time working from home. So we have a full arsenal of a lot of different skills and backgrounds within our CIC teams, not just here at Philadelphia, but at all of our different sites. And we're offering that up as a way to help support our clients with any specific project work or initiatives that they may need an extra eye or an extra hand on. So if you have anything that you're kind of specifically looking for in terms of a skill or just a specific project you need help on, please, you can either email the events team. We also have a link to a form that you can fill out with some details on your project. And once you fill that out, someone will get back to you on that. And last thing that I just want to let everyone know about is our CIC resource guide that we've created online. Just during this time of COVID, we noticed a lot of grants, loans, different resources and organizations offering up their services to help small businesses and individuals during a time like this. So we put together just a quick resource guide of things that we thought were most relevant and helpful for people in our community and for entrepreneurs. So feel free to check that out as well. And I'll drop those links into the chat.
Nice, Mina. We're going to kick it back one more time to Melina to cover just any other additional labs updates specific to space use.
Cool, thanks, Emmett. Just one thing I really wanted to emphasize, which is that the 5th and 6th floors do have some policy differences to the rest of the CIC space because of the labs. And so two things that are really important to know about the 5th and 6th floors. The stairwells are not directional. So we want people to use whatever stairwell is the closest to their lab to reduce the chance that they're moving hazardous materials through the hallways. So for the 5th and 6th floors, you can use either stairwell to go up or down. The other thing is that we don't allow nitrile gloves on the 5th and 6th floors in the hallway. That's because folks are working with a lot of hazardous materials in the labs that are not COVID, but they're still hazardous materials. And we want to make sure that we can tell when people have clean hands, that they're, opening doors with clean hands and things like that. If you are concerned about touching door handles because of COVID in the 5th and 6th floor hallways, we provide wipes and we provide these clear plastic gloves. They're sprinkled throughout the space and they're available for your use. We just ask you not to wear nitrile gloves on 5 and 6. Thanks.
So to clarify, and this is a question genuinely for me, nitrile gloves are
Sorry, they're the kind you would see a doctor wear. So the blue or purple kind of very stretchy gloves. They're opaque. Most of the ones that you're able to buy when you just search for gloves would be nitrile gloves. So the kind that we are allowing people to wear are the clear plastic ones that you can see through. It looks like what somebody at Subway would use to make a sandwich, or any kind of wipes, tissues, things like that.
Awesome, makes total sense. And with that, we're going to open up the floor to any general questions on anything you've heard today, or any clarifications specific to perhaps your organization and how they might need to move forward into the CIC space. And of course, if we've done an excellent job already, in fact, a perfect job, we're welcome to tune off anytime.
Does it have to be in the chat?
No, you can, at this point, you can definitely just tune in.
Okay, great. Thank you. This is Alex from Arrow. That was really helpful. I just had a question about the private offices. Is CIC putting a cap on, like, aside from the maximum capacity that you've already set for rent, but for social distancing, are you capping private office spaces? And is the cleaning schedule still such that we like leave our trash outside during the week so that people aren't coming in and out, or how is that modified?
So I'll jump in, Alex, for with regards to your question about the cap, and then Ian can speak a little bit about the cleaning. So with regards to the caps that you asked about, we're actually not capping the offices. We are only providing recommendations. So if any company has questions about what the square footage of their office might be and what it might look like to have a certain number of people in that square footage that still accommodates social distancing guidelines, then we provide recommendations. But essentially, the office is still your office. It's still a company's office. The company determines what policy best suits their employees. CIC, of course, is still a resource if you need additional information on your office and what it might look like if you had a certain number of roles, or what the maximum recommended number of roles are.
Okay, thank you.
As for the cleaning too, we are still having cleaners only not enter offices at this time unless upon request. So we're actually printing some fun door hanger like options potentially as a way to signify if a client is requesting a cleaner to enter the space. But otherwise, we are still asking them not to enter offices unless otherwise requested. So they can pick up the trash, as you mentioned, trash and recycling, by leaving them outside the door. CIC can also provide cleaning supplies, both for disinfecting desks as well as vacuums and other things like that as needed. Or if you would like a cleaner to come in and vacuum your carpet or take your trash out or something like that, we can work with our cleaning company to let them know
Okay.
when to enter the office and when not to, essentially.
So does CIC have, I know that nobody has a surplus per se of like disinfecting wipes and stuff, but we've been asking our folks to do the same clean in, clean out procedures in our private offices as everyone's been doing in the common spaces. So do you have like wipes and stuff available, or like disinfectant spray bottles or something that we could have in our office spaces as well to minimize the amount of cleaning staff coming in?
Yep. Yes. So we actually did. We've done a lot of work with our global team. Has put in a lot of work to try to find resources for disinfectant wipes and cleaners, and we do have some to provide to clients as well. So if you all would like some to clean in and out for your desks, you can just let us know, and the community team can get some to you. So we have both disinfectant spray and disinfectant wipes.
Okay. I'll shoot. My short answer is yes, we would like that. I will send you guys an email to confirm. Thank you.
Yeah, definitely.
One area we continue to watch as a company is just the state of parking in the local area as more companies come back to work and get employees back to work and avoid public transportation. What's it like?
Yes. So we have had, they have started enforcing street parking again. So for most of the kind of stay-at-home order that was rescinded, we have an agreement with a lot in the area. We were actually now completely full up in our lot. We can see if there is a way to potentially to see if we can work with our lot to see if there are more spaces available. But that would be something we'd have to reach an additional agreement with LAZ, the parking company, with. I know we did put together some more information about lots in the area. if someone has that handy. If not, I can track it down and try to drop it into the chat here. Thank you, Stephanie. So there are a few other lots in the area with various rates. And we have also worked with our parking company, our lot, to look into day rates before as well. So we've been able to provide day passes for companies at a larger scale as well.
And I'm sitting on the second floor right now and can see three different of the parking lots in the area, and they are all relatively empty as compared to before. So like there's a ton of availability day to day. I'm not sure exactly what like the membership aspect of that is, and that's definitely something that we could assist clients in looking into as we go forward. But it seems pretty available, and there's even street parking that I see right now available. So
Terrific. That's really just trying to keep an eye to see if it's starting to become an issue that we need to get ahead of for our employees. So that's great to hear. Thanks.
Yeah.
Great.
Well, if there's nothing else, thank you all very much for coming. It's been really nice making sure that everyone's up to speed, and we look forward to working with you on site again.